Here we will talk a little basics about ultrasound which will help us with its use in critical care. Sound, when it travels through a medium, undergoes four phases: attenuation, that is, it dies down over a distance; reflection, refraction, and scatter. What classically happens when ultrasound beams hit air, they get scattered all over. In medical ultrasound, waves of 2 MHz and more generated by crystals placed in a probe is passed through tissues. The waves are reflected from the tissues and captured by sensors in the ultrasound probe and converted into image. Based on tissue character, the image is available in a spectrum of grayscale from being bright to dark, and that is what is called echogencity. The images are labeled from being hypoechoic to hyperechoic. The term isoechoic is used when two images look comparably the same in brightness. A dark image is called hypoechoic, like water and fluid both appear dark. A bright image is called hyperechoic, like bone and air is bright because it scatters all the ultrasound beams. Fat and fibrous tissue also appear bright, so you can consider them in between. And tissue produces various scales of gray. They can be compared and contrasted against one another. Sometimes we may look at the echogenicity of liver against the spleen or the kidney. Now we also need a place through which the ultrasound beams can pass through the skin. Structures like bone reflects all the waves back, so we can't see much, and air scatters it all over. So even if there is a speck of air, ultrasound becomes impossible. The biggest challenge is doing it in the presence of subcutaneous emphysema. And make sure that you apply the jelly very well and place the probe in such a way that there is no air pocket between the probe and the skin. We need to choose window which allows sound to travel easily, and it should also facilitate a detailed imaging of the organ of interest. There are standard windows for imaging, and we can rock and rotate the probe to get the best views. Echocardiography windows are best defined, and we can also adjust the depth of a window to center stage the area of interest. Now, gain and depth. Now, gain is a function of how to brighten an image or how to produce greater contrast. Even in a single image, the gain can be applied at various depths in some machines. In some machines, and most of the modern ones, the gain is set automatically depending on the pre-selected area and the type of probe. We can adjust it to our choice if need be. And the depth can be adjusted for bringing a structure into focus or to cover a greater area. The probes are defined by the frequency, resolution, and depth. The waves which they transmit vary from 2 to 15 MHz. Waves with high frequency have higher attenuation and cannot travel far. Thus, high frequency probes are best suited to study superficial structures. They produce excellent image resolution. Waves with relatively lower frequencies penetrate better and gives detail about a greater area but with lower resolution. In general, a standard ultrasound machine has 3 probes of different frequencies and different footprints designed with our imaging needs in mind. One is a linear probe. It's a probe emitting high frequency ultrasound, and they emit the rays in a linear fashion. The footprint of the probe is wide, thin, and generally the depth to which can provide detail is a few centimeters. It is good for superficial structures like blood vessels, so cannulation, all we do it with linear probe, pleura, and the study of superficial soft tissues and muscles. The curvilinear probe, it emits relatively lower frequencies, can provide images of deep structures, and has a large footprint. The waves also span out, and thus even in width it covers a large area. This is most suitable for abdomen and also when we need to scan large areas in one go. The phased array probe, also called a cardiac probe, specially designed for imaging of the heart. It has a small footprint which allows it to sit between the ribs, and the waves span out to provide bigger volume for imaging. We can use any of these probes keeping in mind their advantages. And what about this B and M mode? The B is for brightness mode and gives us an image of a cross section in various shades of grey. And M is for motion mode. When we want to study a structure in motion, like the ventricular walls or the valvular movements, we can focus our probe at one place and get images as seen over passage of time. It is good to do measurements. It mainly finds application in cardiovascular ultrasound. If need be, we can also acquire skills in Doppler. Otherwise, this is the basic that we need to know.